Hello and welcome. I'm Michelle Goldswain, Account Manager Lead at Silicon Practice. So thank you very much for joining this session on how digital tools can support people living with and beyond cancer. So over the next 30 minutes, we'll explore challenges in cancer care and how technology can complement the compassionate work that you already deliver. So please feel free to pop any questions or reflections in the Q&A section on the left as we go. So we'll have time at the end to cover as many as we can. Okay, so here's the journey that we're going to take over the next half an hour. First, we'll start with a quick introduction to Silicon Practice, who we are, and how our experience in digital healthcare has led us to focus on oncology. We'll explore the pressures of facing cancer services, rising patient numbers, complex treatment pathways, and the information burden on both staff and patients. And I'll highlight why traditional approaches alone aren't enough. So next, we'll discuss how well-timed, bite-sized information delivered through apps and portals can reduce anxiety, improve decision-making, and empower patients throughout their journey. And I'll also share real examples, so from trusts and charities already using digital tools to support cancer pathways, along with the benefits that they're seeing for their patients and staff. And finally, we'll then wrap up with any of your questions. We'll have a short checklist you can take away with you as well to assess any opportunities for introducing or scaling digital support in your own service. So before we look at challenges in cancer care, just a quick introduction to who we are and also why we're talking to you today. So Silicon Practice has been working alongside the NHS for more than 2 decades. So we started with patient-facing websites and online consultation and video consultation solutions. We've then evolved into building healthcare apps that help services manage communication, education, and workflow. We now support over 100 NHS organisations, from community teams to large acute trusts, with tools to make it easier to keep patients informed and also to help staff focus on direct care rather than admin. Over the last couple of years, we've been working closely with oncology clinicians, CNSs, and patient representatives to develop solutions that fit unique needs of cancer services, from diagnosis right through to treatment and into recovery. Everything we design is built with 3 priorities. The first being accessibility, so that every patient, regardless of digital confidence, can use it. Security, because we know how sensitive cancer information is. And also evidence-based design, so this is grounding features in patient feedback and published research. Our aim is to complement and not replace the personal and compassionate care that you already provide every day. So let's have a look at the scene that's happening now in cancer care. So first, more people are living longer after a cancer diagnosis. So this is thanks to earlier detection and advances like targeted therapy, immunotherapy, and survival rates continue to improve. Macmillan projects that by 2030, over 4 million people in the UK will be living with and beyond cancer, which is fantastic news, but it also means many more people need personalised support over a longer period of time. So secondly, treatment pathways are becoming increasingly complex. A single patient may have surgery, chemotherapy, radiotherapy, immunotherapy, or a combination of these, and often across different locations and teams too. So coordinating all of that and making sure that patients understand what is happening is, of course, a huge task. And thirdly, there are workforce pressures, clinical nurse specialists and other oncology staff that carry very high caseloads. And even with extraordinary commitment, it's still difficult to give every single patient one-on-one time that they'd ideally like. And finally, patients themselves find they're facing information overload. So they're handed leaflets, appointment letters, verbal explanations, but it's also easy for those key points to get lost, especially when someone is anxious or tired from treatment. Many people say things like, what did they say about the side effects again, and trying to remember all of that information. And these trends mean that we need smarter, more scalable ways to support people without losing that human touch. And this is where carefully designed digital tools can really make a difference. So before we look at solutions, it's worth pausing on what happens when we only rely on transitional channels for patient information and support. So paper leaflets and printed packs have been the backbone of patient education for years. And they are helpful in the moment, but they're easy to lose. And once they're printed, they can become outdated very quickly. If guidance changes, for example, if there's a new side effect management protocol, we then need to reprint, redistribute, and hope that every single copy is the right version that's going out. And next, there's the sheer volume of phone calls and emails that cancer teams receive. So many patients just need a small piece of reassurance or clarification, yet they're sitting on hold and leaving messages, and clinicians are then spending their precious time repeating information that could have been available elsewhere. Another challenge is timeliness. So a lot of advice is given verbally in appointments, and if the patients forget or need help out of hours, there's often no easy way for them to find accurate guidance straight away. And the gap can increase anxiety, and this can often lead to unnecessary A&E attendances, and if people aren't sure whether their symptom is serious or not, so that can lead to that. Finally, there's information burden on both sides. So patients will receive large amounts of detail when they're stressed or unwell, so only part of it's then sticking. Meanwhile, staff feel that they are repeating the same messages dozens of times a week, which contributes to that fatigue and limits capacity for complex support. These pain points highlight why services are looking for complementary modern ways to give patients the help they need while protecting staff time and also staff well-being. Apologies, one moment. Okay, so, I think it might have gone back one there, I apologise. Okay, so let's have a look at how one NHS trust is already making a difference with digital support. And this case study comes from Shrewsbury and Telford Hospitals NHS Trust, who provide district hospital services for nearly 500,000 people across Shropshire, Telford and Wrekin, parts of Mid Wales. With over 700 beds and a wide network of outreach services, their challenge was clear. So that's how to give patients, families and carers consistent, accessible information across multiple hospitals, teams and departments. So working with Silicon Practice, they developed Cancer Services app as part of a wider umbrella app. And each app inside this platform serves as a specific audience or pathway, but sits within one easy to manage container. So for oncology, that meant that a dedicated space where patients and carers could find information about treatment and services, contact details for key staff, emergency procedures, and also links to trusted support organisations. This app isn't just for patients. SATH also uses the platform to support staff, housing, internal training resources, policies, procedures, HR information and events, and that's all in one place. And this dual use has made the solution more sustainable and valuable. Leah Morgan, their personalised care and cancer improvements facilitator, has explained why they've chosen the app as part of a long-term plan. So there's a strong focus on personalised care, on giving people access to health and well-being information at the right time. So initially their app was designed mainly around treatments and team details, but it's grown into a central channel for communication, benefiting patients staff, and also the wider community. So as Leah put it, the people can access the information that's easily to improve patient experience. So that's exactly the goal, is giving people the clarity, reassurance and support, whether they're sort of starting that cancer treatment or navigating life beyond cancer. So next, let's have a look at how Royal Surrey NHS Foundation Trust has transformed their approach to supporting people with advanced or metastatic cancer. The Enhanced Supportive Care, or the ESC service, was launched at the Royal Surrey in 2019 to give patients faster access to expertise on managing side effects of cancer and its treatments. So when COVID-19 struck, face-to-face contact obviously become a lot harder. So the ESC team, with help from Kent, Surrey, Sussex Academic Health and Science Network, searched for a way to gather patient-reported outcomes remotely while still offering personalised support. So they chose to co-design an app with Silicon Practice. It was then called Piotr, or the apps were then managed by Piotr. The solution lets patients complete the MSAS-SF symptom questionnaire on their own device before appointments and provides clear updates and reminders, trusted guidance materials, and signposting patients to supportive services. So this change reduced the time spent on paperwork in clinic, letting staff focus on what patients said really mattered. Importantly, patients who preferred, sorry, my internet keeps slowing down, so I keep losing which page we're on, apologies. Importantly, patients who preferred not to use the app still complete paper forms or receive printed information, so digital support was an addition and not a barrier. A real-world evaluation by Unity Insights found promising results. So 24% of patients were interested in the app, 16 registered, and every patient that gave feedback rated it as good or great and said that they'd recommend it. So Emma Dillsworth, the ESC project manager, summarised it well. So after 2 years, the app is embedded in our service. So this is a quote from Emma. And we can see the potential to expand its use moving forward. And the ESC clinical nurse manager, Joanne Thompson, noted that having an overview of patient symptoms before consultation means that we can focus on what's most important, what's important to them. This case shows how digital tools can strengthen shared decision-making and personalised care, even in the challenging context of advanced cancer. So how can digital solutions help us address those pain points that we've just discussed? First, they give patients single trusted source of truth. Instead of juggling leaflets and websites or old letters, they've got one secure place that they know the guidance is correct and also current. And it helps staff. Everyone is speaking from the same page, which reduces those conflicting messages. Secondly, digital tools provide 24/7 access. So whether it's 2 p.m. or 2 a.m., patients are able to check reliable information, see what they can do about side effects, or remind themselves of appointment instructions, and this reassurance can make a huge difference outside of normal clinic hours. Next are notifications and reminders, so simple prompts, for example, a reminder of a local support group, and this can then prevent small issues from becoming bigger ones. And finally, it's really important to stress that digital tools are designed to support and not replace the human care that oncology professionals already provide. By taking away those repetitive admin and standard information sharing tasks, they're sort of freeing up staff to focus on complex decisions and emotional conversations, so those areas where your expertise and empathy really shine. When used well, digital technology becomes an extension of the team, making it easier for everyone to give or receive the right support. So, so one of the most powerful aspects of digital tools is how they can deliver the right information at exactly the right moment. So instead of giving patients a huge bundle of material at diagnosis, much of which may not be relevant until months later, so an app can actually tailor that content to their journey. So for example, for somebody who's just been diagnosed, they might receive a simple overview of their pathway and a short video explaining those treatment choices. And then as they move into chemotherapy or radiotherapy, a more detailed guidance and tips can be then, can then appear for them. Good design also means information is structured and easy to find. So patients can browse by topic, search for a symptom, they can save favorites, and then they're not scrolling endlessly when they're tired or anxious. And another advantage is the ability to stage the release of information so that rather than flooding patients with everything at once, you can then drip feed that information of what's needed at each step. So for example, a checklist for preparing surgery and then a post-op sort of care instructions after discharge. We also have the chance to cater for different learning styles. So a quick video or an illustrated step-by-step guide, or even an audio version for patients that prefer to listen. So this flexibility ensures support reaches a wider range of patients and carers. And then above all, when patients receive timely, clear information, it can reduce anxiety, increase confidence, and they know what's happening now and what to expect next, which makes them feel more confident and in control of their experience. Okay, so after active treatment ends, patients often have a feeling of, they describe it as being cut adrift. So the appointments become less frequent, but anxieties about the reoccurrence or lingering side effects can be very real. And stage 3 is about helping people recover and live well. So supporting them as they rebuild strength and confidence. One area where digital tools can shine is in gradual return to strength. So personalized tips about pacing activity, rebuilding stamina, and healthy nutrition can help people take control of their recovery journey. Emotional well-being is another major focus. So guided mindfulness sessions, gentle self-help modules, or peer stories can normalize what patients are feeling. So some may benefit from links to local national support groups as well, giving them somewhere to talk and connect. Education on late effects and reoccurrence signs also matter. Apps can provide easy to understand modules on what to watch for and encourage people to seek advice early if something doesn't feel right. It's building that sense of community. It's often transformative. So moderated forums or small virtual meetups give patients a safe space to exchange tips, celebrate milestones, or share setbacks. By focusing on physical health, emotional resilience, and clear information, we can make survivorship a positive, hopeful chapter rather than an uncertain one. Now, we'd love to hear from you. So where do you think digital can make the most meaningful impact on your own cancer pathways? It might be supporting newly diagnosed patients, improving communication between clinicians, or helping families to feel more informed and involved. So please pop your thoughts in the chat, or if you'd prefer, use the poll on the screen, which should come up shortly. This is a chance to reflect on today's themes and consider what would make the biggest difference in your service. If there's anything in the chat as of yet. Okay. Lauren, I don't know if you can see anything at all from your side. Is anything that's been...
Yes, it's really interesting. Lots of people have voted, so thank you so much for everyone for getting involved. But the number one thing that's come out is the information overload and timing. Joint second place was consistency across teams and patient engagement and confidence. And then in last place was supporting carers and family. So the information overload timing is our winner on that poll.
Yeah, that's interesting. Thank you very much for that. Okay, shall we move on to the next part then in that case? Thank you very much. If there's no questions, is there any questions in the chat at all or anything?
No questions yet, Michelle, but we do have a Q&A session towards the end.
At the end, so fine, we can do that then as well. Lovely. Okay, I'll move on to the next part. Thank you very much, everybody. Okay, so we've pulled together a practical resource to help you get started. So 5 steps to launching a cancer support app. It's a concise checklist, covers all the essentials, so assessing your service needs and goals, involving patients and carers from the start, building staff support, planning who owns and updates the content, and continuously measuring engagement so you can refine over time. You can scan the QR code on the screen right now, or to download it. It's completely free, and it should help you take the first steps or strengthen the digital solutions that you've already got in place. Okay, I'll just give you a moment if anybody wants to scan the QR code at all. Okay, and we'll of course send some more information out as well. Okay. Lovely. So thank you very much for joining us today. And we hope that the ideas that we've shared have sparked some inspiration about how digital tools can support people living with and beyond cancer. We'll send you the webinar recording, of course, as well, and the 5 steps to launching a cancer support app guide. Before we wrap up completely, as Lauren mentioned then, the floor is now open for any Q&A, so please feel free to submit your questions via the box on the left, and we'll do our best to answer as many as we can. Thank you.
We have had a question come through. This one might be better suited to Carl. What is the cost of an app roughly?
Yeah, thanks, Lauren. Hi, everybody. So the app depends on the amount of users you want on it, but for 0 to 500 users, you're looking at roughly £2,250 per year, and then there's a setup cost of £1,000. So I hope that answers your question.
And we've had another question come through. What features have found the most useful in cancer settings to patients and clinical teams?
Sorry, can you repeat that when you broke up there, Lauren?
Sorry, Carl. What features have provided the most useful for cancer patients and clinical teams?
So for the patients, it's been able to get access to the information. So we've got a contacts page on there. So if they're searching for a number, they've not got to go looking through leaflets and pamphlets trying to actually reach out to people. So via the app, you can literally click on it to either dial or send an email. So from a patient point of view, and even carers and family members as well, it's having that ability to find the information quickly and understand what their family members are going through and seeing what the journey is for them. For the staff, if you're using it for staff as well, it's having the ability to actually get access to information. So you might just want to look at something quickly. So you can have different areas within the app. So you can have it restricted. So it's open to the public. So obviously patients and carers don't have to register, but if you're using it as like a hybrid, you've got an access area there. So the staff members can access information which only they can see, and they can quickly look at policies and information and share information with patients, which is visible to them as well.
We've had another one come in. Do any of the apps launched have a section for acute oncology / triage? Would that be a possibility?
They don't have a section for triaging. There's forms and surveys and polls, so you can create questionnaires, polls and surveys and everything. And a lot of the apps what are currently being used when patients are coming in for appointments, they ask to fill in the information, so it gets submitted prior to them going, so they're not filling it on the day. It gets delivered into a dashboard, so potentially you could use it for something like that. But the app doesn't make any decisions based on what's put in there. It still needs a human to look at it and take the information from there. So it's purely like information sharing and information gathering.
Okay. I apologise if I'm not reading this correctly, but do the apps where PTS complete symptom assessment link into patient digital medical records?
Don't really understand that one, but there's no actually linking for the information we receive from in the app into the back end. But it is all password protected. You can export it out, so you can link it into, you can get it as like a CSV, and you can import it into any third-party systems if you want to. We can also look at links to other systems via APIs. So if there's an API available, then we can send information to it.
Have you got experience with patients on clinical trials and using the app or app supporting clinical trials?
Not clinical trials, no, but say the app is basically a way of sharing information, so it doesn't matter what you're using it for. So it's, you know, it's not specific just for cancer patients. We've got these as user student toolkits, we've got for diabetes, we've got them purely for staff members. So as long as the information's there, you can share it, so we can tailor and configure the app to be used for anything really.
Fab, thank you, Carl. We've not had any other questions come in. Just double check. No new questions. So I think if nobody else has any questions, we could wrap it up there. As Michelle mentioned, we will be following up with a recording of the webinar, the 5 steps to launching a cancer support app checklist. And yeah, if you do have any questions at that point, please feel free to come back to us and we will get back to you. But thank you so much to everyone for joining us today. And we massively appreciate your time. We understand everyone's really busy. But yeah, thank you very much, everyone.
Thanks, everyone.